Hello and welcome to the Type 1 Diabetes Community Series hosted by the Mary and Dick Allen Diabetes Center at Hoag Hospital. We are going to be talking about understanding and maximizing your insurance today. And if you're thinking maybe you've heard this before, it sounds familiar, you're right. We did cover this topic earlier in the year, and we got such an overwhelming response of people saying that they wanted to hear more about this, they wanted to talk about it again, that we decided to pop back in right before open enrollment and go over all of this information, add some new facts, and answer some questions as people approach that time of year where they get to select their coverage for the next 12 months. I'm Samantha Markovitz. I'm a national board certified health and wellness coach and also the supervisor of health and wellness initiatives here at the center. And I'm excited to be here with our center director, Dr. David On.
Yeah, thanks, Samantha. So I'm an adult endocrinologist. I'm the program director here at the Diabetes Center. I really love helping people with type 1 diabetes. And unfortunately, insurance is such an important part of living with type 1 diabetes. So I'm really excited for what we're going to be sharing and learning today. The bulk of the topic will be educated by Samantha, so I'll be the Robin to her Batman, but I will pitch in from time to time with some of my perspective as a prescriber, helping different types of people with type 1 diabetes. If you do have questions along the way, please feel free to ask them in the chat or in the question and answer box. We will be looking at it throughout the course of the talk. If it's super time sensitive and appropriate to kind of hop into the discussion, I'll throw it in and ask Samantha on the spot. Otherwise, we'll probably answer the bulk of the questions at the end of the discussion. So, take it away, Samantha.
All right, thank you very much. We want to thank you for joining us for this presentation. We really hope that you'll find it educational and hopefully you'll walk away feeling empowered to navigate your health coverage as a person living with type 1 diabetes or as a person who loves someone who lives with type 1 diabetes. Coverage can really vary between policies and plans, and changes can be made to those plans over time. So if you have any questions about what applies specifically to you and your coverage, we definitely recommend that you go directly to the source of your coverage. And certainly if you have any questions about your diabetes care regimen, we recommend that you speak directly with your care team. This is also a great time to note that we'll be mostly focused on commercial insurance for adults living with type 1 diabetes. If you have questions about other types of insurance or other demographics, we'll certainly do our best to point you in the direction of a resource that will be helpful for those specific questions. And we also want to remind you that this presentation will be available for viewing later on the Hoag Health YouTube channel. So don't worry too much about having to write everything down or worrying that you're going to miss a sentence here, a sentence there. You can always go back and take another look or listen. And if you find this information helpful and you think it could help someone else that you know, you can always send them the link and they can learn about it too. All right, let's get into it. Lots to cover. So there are substantial reasons why a person would want to maintain comprehensive health coverage regardless of having diabetes or not. However, as we all know, the many costs associated with diabetes, like the high cost of insulin, specialist visits, complication prevention and screening, and treatment, are just a few reasons why you would want to make sure that you have health coverage that can help defray the cost of those things. Insurance certainly doesn't take on the full financial burden of living with diabetes and just being a human who needs regular maintenance, but it can certainly help to, as I said, defray the cost, those out-of-pocket costs to you as the patient. So we know that the system that we have definitely has its issues, and that is certainly a topic that we could talk about on another day. But it's worth highlighting some of the provisions of recent healthcare reform or the Affordable Care Act that have positively impacted people living with diabetes and how they interact with health insurance. There are definitely things that we can continue to work on, but prior to the ACA, things were pretty rough for people with diabetes and health insurance. So I think it's important that we talk about the things that we do have access to now that things have shifted a bit. So the law now allows for young adults to stay on their parents' plan until age 26, with a few exceptions. Certainly, there are certain things that insurance companies must now agree to cover as part of those essential health benefits. And they have to, say, include coverage for insulin for people with diabetes. They're not allowed to exclude that any further. There's no longer a lifetime limit on how many dollars can be spent by a health insurance company for coverage for that person with diabetes. And people with diabetes cannot be denied coverage under a health insurance policy or be charged more than other people without diabetes for that same coverage. These are all changes that have taken place. And if you are encountering a plan that is telling you the opposite of any of this, you can definitely use these points to counter back to them and advocate for yourself in that process. In addition, something else that was part of healthcare reform is the expansion of Medi-Cal, which is California's Medicaid program. So that has a much wider reach than it has had previously. So folks who do not have coverage but are also not eligible for Medi-Cal may also qualify to receive premium subsidies and cost sharing to help cover their healthcare costs. This can help bridge the gap between not being qualified for Medi-Cal and also maybe struggling to afford comprehensive coverage on your own. It's important to know that these are things that can help you access care. The individual mandate, or what some people think of as a fine for not having insurance that meets the ACA standard, has been struck down on a federal level. So that is no longer in place there. However, in the state of California, that is something that is very much still part of the law here. So that basically means that you will pay a penalty if you choose to not maintain comprehensive coverage. So if you are going to be spending some money in that way anyway, might as well put those healthcare dollars towards insurance that can help pay for those costs of living with type 1 diabetes. So if you're going to do that, which we all should aim for that, how can you get coverage and how can you stay covered? All right. So one very well-known way of getting covered is employer coverage. This is something that tends to be the norm in the US. Typically, if an employee works at least an average of about 30 hours a week, they're considered full-time in the eyes of the ACA, and employers of a certain size must offer health insurance to these individuals. So if that is a situation that you find yourself in, you may be looking at choices offered by your employer. As I mentioned earlier, if you are under the age of 26 and your family agrees to have you on the plan, you can stay on that family plan with your parents. If you have a spouse or domestic partner who has access to employer-provided coverage that allows dependents, you can join them on that plan. If you were to lose your job, as unfortunately many people experienced, shifts in employment this year, or maybe a situation where your hours drop below insurance eligibility, you will have access to COBRA, which is a continuation of your current coverage. There's pros and cons. One plus is that if you elect for COBRA coverage, you don't have to change your insurance in the middle of the year, and you can continue paying towards the same deductible and out-of-pocket max. The downside is that COBRA can be quite costly, since you would then become responsible for the full premium instead of sharing the cost with your employer. The American Rescue Plan Act of 2021 included a 100% COBRA subsidy for eligible individuals up to 6 months, which actually ends tomorrow, the end of September 2021. So unless there are any last minute extensions, that may go away either temporarily or permanently, but it's definitely important to know that if you've been dealing with COBRA, that's something to look into. And if you're not able to access health insurance from one of these other sources and you meet income eligibility requirements, you may be able to gain coverage through Medi-Cal at low cost or no cost to you. If you are self-employed or you don't have access to other sources of coverage, but also find that you're not eligible for Medi-Cal, you can utilize the Covered California Insurance Marketplace, or as people sometimes call it, the Healthcare Exchange, and you can search for coverage there. There are both federal and state subsidies available to help make those premiums more affordable, and depending on your situation, you may also be eligible for cost sharing of services within that plan. So if you're unsure of how to find the right plan for you through the exchange, or you have questions about your eligibility for these different programs, I highly recommend consulting with a licensed insurance broker. This is something that you can do that has no cost to you as the individual, and you can work with this broker to find coverage. They can help you throughout the process by providing quotes. They can get you information about the plans, answer questions, and once you elect coverage, they can still be a resource for you throughout the year if you have any questions or issues that come up with your coverage. So that's definitely something to consider if you're going on your own and looking for insurance coverage for the coming year. Something that you'll want to pay close attention to is knowing when you'll be electing coverage. Most of the time, that is going to be during annual open enrollment, which is something that's coming up for us right here. Covered California open enrollment for coverage that becomes active on January 1st, 2022, begins on November 1st, 2021. The open enrollment period ends January 15th, 2022. California has kept open enrollment open throughout the pandemic. So if you need immediate coverage, you can apply for Medi-Cal, CHIP, which is the Children's Health Insurance Program, and Covered California Insurance using the same application at coveredca.com. So that's something to keep in mind if you're in a situation today where you're needing coverage that will keep you covered between now and December 31st, 2021. So that's something separate than electing coverage for 2022. So keep that in mind. And I think we can all agree that COVID has really impacted a lot of things for people across the country. And certainly insurance enrollment has not been immune from that. Thankfully, there have been a lot of efforts to help folks keep their insurance coverage or get new coverage if they lost their insurance during this past year or so. And the data reflects that enrollment in employer-sponsored insurance actually declined during the pandemic, which is probably not surprising given the economic situation. However, the good news is many people enrolled in coverage through other sources at that time, including government programs like the Affordable Care Act, marketplace coverage, and Medicaid. So there are options if you are concerned that your coverage has shifted and you're not sure what's going to happen for you this year or for next year. Additional qualifying life events, so QLE, as you can see here on the slide, these are things that can offer you the opportunity to enroll in or make changes to your health coverage. These are things that might include losing a job, having a change in income, turning 26, marriage or domestic partnership, change in your household size, maybe the addition of a child, for example, maybe being affected by a natural disaster like a wildfire, being released from incarceration, domestic abuse, returning from military service. There are so many different things that can qualify as a qualifying life event. So if your circumstances have shifted or they shift during your coverage time, you can re-enroll in something else. You have 60 days from the qualifying life event taking place to make that change in your healthcare coverage. So that is something to keep in mind as things are ever changing. Whether you're making a choice between a couple of options that your employer is offering you, if that's your situation, or maybe this year you're shopping for your own policy, it's really important to take the time to do thorough research about the differences between your plan options. We're going to talk more about what to look for so that you can compare most effectively. And it's really important to know that once you've made your selection, it's really your job, something that you want to take pretty seriously, to know what the details of your plans are so that you can utilize it to its highest potential during the plan year. And when you are going to look at comparing your plans, something that you can start with, it's a really simple first step, is just to review the summary of benefits and coverage. So this is a document that all insurance companies are required to provide as a result of the healthcare reform. It's a standardized summary of health plan benefits and coverage. And this includes things like your covered benefits, cost sharing examples, coverage limitations and exceptions. And it's usually the first, like the top of the stack, if it's a stack of papers that you've been handed, or the first thing that you're looking at the top of a page where you're scrolling. So keep that in mind. Let's talk about common types of insurance plans. Let's demystify the many letters, the alphabet soup of insurance plans. So the most common types of insurance plans that you'll be running into are PPO and HMO plans. A PPO typically has a higher monthly premium or cost for coverage. You can select your own doctors from the network with no referrals required. There's no authorization required for basic medical coverage, but there is still a possibility that you may need some prior authorization for services, medications, or supplies, and you may find that certain types of items are excluded from the plan. So the other thing about PPOs is that you may have and are likely to have access to out-of-network care options. So if you need or want to pursue out-of-network care, you can. It usually is at a higher out-of-pocket cost for the patient, but it is an option. And the bottom line on PPOs is really that they allow for a high level of flexibility and patient autonomy. So you get to decide where to go for your care, and there really isn't as much red tape to make that happen. You just kind of make a choice and go for it. So on the other hand, HMO plans usually come in at a lower monthly premium, and your care is coordinated by a primary care physician who issues referrals for other providers. So let's say you're needing to see an endocrinologist for your diabetes, your primary care physician is going to need to see you first to write that referral for an endocrinology appointment. And then the medical group has to approve that referral, and the insurance company has to approve the referral before you can move forward with a guarantee of coverage for that service. So there's definitely steps involved in getting the care that you need. And folks can often save money by going with an HMO, as long as they can tolerate the potential restrictions and longer timelines for approval, which are important to take into consideration. There is no out-of-network coverage on HMOs typically, and HMOs really do have a lower level of flexibility and patient autonomy for the reasons that we kind of just discussed there. Two other common types of plans include EPO and POS plans, which can oftentimes kind of present like hybrid PPO HMO options, depending on the details of your coverage that you're being offered. In an EPO, you may or may not be required to have a PCP that coordinates your care. There are typically no referrals required, so you can be self-directed. And you typically don't need authorization for basic medical coverage. You may need some PAs or have some items that are excluded from coverage, but overall, you're going to be encountering a moderate level of flexibility and patient autonomy, and you'll find that there may be a slightly higher out-of-pocket cost for you as a patient. And with a POS, a PCP will be required, and referrals may also be required. You may be able to access out-of-network care. That's dependent on the plan specifics. And again, no authorization needed for your basic medical coverage. Certain items may need a PA or be excluded from your plan. So it's important to know what those things might be. And this type of plan is more of a medium level of flexibility and patient autonomy. You can see here on the screen kind of a compare and contrast of these four plans now that we have gone over them. Keep in mind, once you elect coverage, you're committed to that for a certain amount of time after confirming your choice. So if you're making an election for coverage mid-year, you'll usually have this plan until the end of the calendar year, unless you drop the coverage for some other reason. And if your coverage begins January 1st, which is typical, it will usually run through the end of the calendar year on December 31st. There may be exceptions though, so it is important to make sure to confirm your plan date so you have an idea of how long you're locked into your current plan. A quick note here. Yeah, absolutely.
Quick question from the audience. Someone asked, do you find that PPOs cover diabetic supplies at a better rate than HMOs, or is it the same or worse?
Ooh, that's a good question. It depends. Anyone who's come to my type 1 diabetes support groups know that's my key answer to most questions, or how the answers start anyway. This is where it really is important to dig into those plan details. Sometimes a PPO plan can have better coverage or more cost-effective coverage for diabetes supplies. However, on the flip side, sometimes HMOs will have really generous coverage for diabetes supplies. Sometimes that has more to do with your employer or the type of plan that it is. So it's not always dependent. You can't always assume that a PPO is going to be better than an HMO for diabetes supplies as far as cost is concerned. Something to take into consideration with that as well is your deductible, because PPOs tend to have a higher deductible than HMOs. So the coverage for supplies might be better on a PPO, but it might take you longer to get that coverage to kick in once you meet that deductible. Whereas an HMO that has a lower deductible, you might be paying less out of pocket to get to the point where they start paying towards it. So very good question. And hopefully we'll continue covering the details that will help someone figure out when they're looking at their options, whether a PPO or an HMO might be more cost effective for diabetes supplies. All right, great. So something that we'll want to make sure to note before we move forward is that healthcare cost sharing ministries and short-term coverage plans do not meet the threshold for comprehensive coverage. If you are considering one of these, I would encourage you to do very thorough research. These options often do not offer much in the way of support or savings when it comes to chronic illness or chronic conditions, things that last over time, or that it may be considered, pre-existing conditions, which is a phrase we've all heard before. And it has a lot of differences from comprehensive health insurance. So be very clear on what it is that you're looking for and what you're looking at before you decide to move forward with one of these alternatives. Outside of their lack of coverage, excuse me, for people living with diabetes, it's important to note that in the state of California, as we kind of talked a little bit about before, opting into a healthcare health cost sharing ministry or short-term coverage plan and forgoing that comprehensive coverage means that you will also owe a penalty to the state for not maintaining that comprehensive coverage. So take all of those things into consideration when you're making your decisions, and just know that is something that you'll need to think about. All right. Let's talk about health savings and flexible spending accounts. So this is something that is not always offered by plans, but can be offered. And if your plan offers an HSA, which is that health savings account, or an FSA, which is a flexible spending account, you'll definitely want to take that into consideration as part of that whole insurance package. So as you can see here on the screen, there are some key differences between the two. An HSA is something that you must be enrolled in a high deductible health plan to qualify to access. So high deductible health plans are always PPO options. Certainly high deductibles can be a mixed bag for people with type 1 diabetes who have a high, moderate to high amount of healthcare spend. If you are going to go with a high deductible plan or a high deductible plan is your only option, it's important to kind of look at how much you're going to need to plan to spend before your plan kicks in and starts covering more. But if you are going to go with that option, an HSA is definitely something to take advantage or consider taking advantage of. For I realize I see that the date on the slide does say 2021, but these are updated numbers for 2022. Your max contribution as an individual is $3,600, and a family max contribution amount is $7,200. So this is an account that you have access to, you own, you'll take it with you if and when you leave your employer. If it's part of an employer plan, you can use the money in that account to cover eligible medical, vision, or dental expenses. It can be used as an investment vehicle, which is kind of an interesting proposition for some folks. So you can definitely do more research on how that could impact your larger financial picture. And the contributions are tax deductible and are taken out pre-tax, and withdrawals are tax-free. So that's something to take into consideration. An FSA is something that has less restrictions on the kind of plan that it can be attached to. You can see that max contribution amount is about $2,750 annually. This is owned by your employer or the provider of the insurance, so it's not portable. You cannot take it with you when you go. So you want to make sure to spend all of that money before you leave that place of employment that's offering the insurance or wherever you're getting your insurance from. It covers the same types of expenses as an HSA, but you may lose unspent contributions and you cannot use it as an investment vehicle, but it does have that pre-tax deduction thing working for it. It's always hard to see money leave your check before it's even hit your account. I think that can be something that's a barrier for a lot of people. They'd rather have that cash in their pocket than have it deducted from their paycheck. But it is something that you'll want to keep in mind because the cost of maintenance as someone with type 1 diabetes, that can cost more than the upper limit on these account contributions. So even in a lower tax bracket, you'll probably save a good amount of money post-tax. And some employers even offer rewards for opting into these programs. So that's something to explore within your plan options. Otherwise, you'll have to pay taxes on that money since it lowers your taxable income. Otherwise, to have that money deducted and go straight to options for spending on healthcare throughout the year. Dr. On, would you give us an explanation of how this pre-tax deduction works?
Yeah, so I think it's an interesting concept to make sure you understand because sometimes if you're not super financial, pre-tax, post-tax, that doesn't really make much sense to you. And once again, I don't do this calculation to say that HSA plans and FSA plans are always the best option because that's not necessarily true, but just to help you understand the potential benefit of this option if it's allowed to you and one of your choices. So say, for example, you're a single adult making $55,000 a year, your effective tax rate would be about 20%. So if you add up your California state tax and your federal income tax. So, I'm sure we're all really sad when we get our paycheck because, say your salary is a certain amount, but then when you add up what actually hits your account, it never is that amount, right? And that's because your employer is taking back tax and they're holding out tax that they're going to pay the government. So the example would be if you're being paid by your job $3,000 a month. So basically that $3,000 pre-tax is, so that $3,000 is about equivalent of $2,500 post-tax. So I'm kind of laughing because the numbers get kind of confusing, but the bottom line is in this situation, that $500 difference between the $3,000 and the $2,500 on the screen represents $500 that you would be losing to tax anyways, if you did not take advantage of the pre-tax deduction. So basically, the long story short is in this example, with the 20% tax rate, by being able to contribute $2,500 towards your HSA or FSA, it's essentially the same it's the same power as having $3,000 that you would have been paid before. So even though you're only losing $2,500, you're being able to spend up to $3,000 because you would have lost that money originally in tax anyways. So it's kind of a trick. So pre-tax savings is very financially helpful if you think about it. And this is for someone making $55,000 a year. As you probably know, as you make more money than that, your tax rate goes up quite a bit. So the top tax brackets will get up to about 40 or 50%. And so that can translate to much more effective savings. So these HSAs and FSAs can be useful in that regard, but it's really important to do the math because sure, you might save $500 from tax losses using an HSA, but if your other costs are way more than $500, then you're overall still losing money. So it's really important just to factor in all the different components that go into your insurance plan to figure out what adds up to the most savings overall throughout the year. So you can't just isolate one single number, whether it's the deductible, whether it's your premium, whether it's your out-of-pocket max. You really have to kind of factor in all these different things, which is why it's so tricky and why we have a whole hour-long talk dedicated to something like this.
Exactly. Thank you, Dr. An. I think that's definitely a helpful kind of first step in understanding how these things can be helpful and impactful financially. Certainly consult with your tax professional or your trusted financial consultant in your life to see how this will play into your bigger financial picture. But we just wanted to highlight that this is something to consider and how it can be especially beneficial if you are someone or you have someone in your family who has a chronic condition like type 1 diabetes, where there's going to be consistent doctor's visits, consistent maintenance medication, devices, supplies, all different sorts of things that you'll want to make sure that you have money set aside throughout the year to be able to cover those costs. And this is a helpful way to have an expectation of how much money is put aside for those costs and also get some tax benefit along the way. So when you're calculating annual costs for your health coverage, like Dr. An just mentioned, there are a lot of numbers that you're going to want to pay attention to, not just any one number. So premiums or your insurance premium, this is something that is paid monthly, either directly from you if you're going directly through, so let's say the healthcare exchange to get your coverage, or it's deducted by your employer from your paycheck and goes to the insurer from there. Those premiums are the cost to maintain the policy. So you want to keep making sure those premiums are paid so that you don't lose your coverage. The deductible is the amount that you pay before the insurance starts paying towards your claims. So those are two important numbers to consider. The premium is that monthly amount to maintain the coverage, whereas the deductible is the amount that you'll pay towards insurance costs, non-covered costs like your prescriptions, doctor's visits, anything like that, before your coverage fully kicks in and the insurance pays that agreed upon rate for those items, those services. Look closely at your summary of benefits and more specifically, the areas that you know you utilize on a regular basis to help get an idea of how quickly you might reach that deductible amount, after which point that coverage will pay that agreed upon amount. So I know I've kind of said that a couple of times, but it's something you really want to process through and think about what that amount of money is going to be that you're going to be needing to prepare to spend out of your own pocket before your coverage starts kicking in. That can be really impactful for a lot of people. So it's really important to think about that. And there may be exceptions about what counts towards your deductible once you get to that point, both in a positive way. So an example of a good way that that would take place is, let's say your copay applies prior to meeting the deductible, so you don't have to pay the full amount for your prescription items from day one. You know, paying that $25 copay for your insulin versus paying $300 for insulin until you meet your deductible. That would be really helpful. There's also a negative way that that can apply. So Let's say there are certain procedures or out-of-network care that does not count towards your deductible. So those are things to think about as far as how you might reach that period of time. And you may be responsible for different amounts of copays or coinsurance pre and post meeting your deductible. So this is the amount of money that you will pay per visit or per service that is not paid by your insurance, those copays and coinsurance. So you'll want to be keeping those in mind as well. Clarify with your insurance ahead of time if you can to see if you have a separate prescription deductible. Some plans may allow you to pay a copay from the beginning of the plan, making your prescription costs exempt from the deductible. I feel like that we talked a lot right there about premiums, deductibles. There's a lot of confusing language there. Hopefully it will all become clear as we continue moving forward. But if you do have any questions about what we just talked about, you can go ahead and pop those in the Q&A box. So we always want to do the best we can to control our healthcare costs. No one wants to be spending the majority of their budget on healthcare. And unfortunately, that is a consideration that we have to make within the system that we have, and having chronic illnesses in our lives or in our family's life. So something that is pretty straightforward that you can take into consideration when it comes to controlling your cost is if you choose in-network providers. So this includes your labs that you get your blood work done, your doctors, your pharmacies, equipment suppliers. You will save significantly in comparison to using out-of-network providers or out-of-network suppliers, pharmacies, et cetera. So as much as you can get covered through in-network, the better. If you need or want to go out of network, you're going to have to accept that that's going to cost a little bit more money. So something to weigh there. And some plans do not offer any coverage for out of network. So if that's the case for your plan, you're going to want to make sure that you're aware of that so that you continue to choose in-network providers and in-network services so you can control your cost. Something else that's important to know about healthcare costs, insurance, something called surprise billing. You may also have heard this referred to as balance billing. Hopefully we're hearing about this less because it's not supposed to be taking place anymore. But if you are hearing about it, here's what you need to know. Here's an example. We have a few examples here on the slide. An in-network hospital. So you know that you went to this hospital that was on your insurance. It's the one that they asked you to go to. And then you're treated by an out-of-network provider, which in a way that you're not able to designate, right? So let's say you go in for a surgery at an in-network hospital, but the anesthesiologist ends up being a provider that's not an in-network provider. Then you would get billed for that out-of-network provider, which you would not be expecting. And then you would have been previously responsible for the balance of that amount and paying that surprise bill. Consumer protection in the state of California ensures now that patients only pay their in-network copays, in-network coinsurance, or deductibles in these situations. Obviously, another really common and unfortunate circumstance where this has taken place is where people are taken to the emergency room, but that facility that they've been taken to is not contracted with their plan. Well, no one's getting into an emergency situation where they're being taken to an ER and they're saying, oh, hold on a second, let me make sure that this one's covered by my plan. That just doesn't happen in real life. And thankfully, now you don't have to worry about being stuck with a surprise bill. So if you are being sent a bill where they are claiming that you owe more for this reason, you can definitely point them back towards the law and have that conversation with them and let them know that maybe they're not aware and you just need to educate them that they've sent you that bill in error. You can get that fixed up. So the majority of the year for people with diabetes is that spot between meeting your deductible and getting claims paid by the insurance, and then hitting that out-of-pocket max. So again, the deductible is that amount that's paid out of your pocket by you, the policy holder, before an insurance provider pays any expenses. And the out-of-pocket max is the most that you will have to pay towards your medical costs for the duration of the policy year. So once your out-of-pocket max is met, insurance covers 100% of costs. Of course, that only applies to services that are covered by the policy, but that can be a significant impact to your healthcare spend throughout the year. So you want to meet that deductible as quickly as possible, and then you want to meet that out-of-pocket max as quickly as possible. And knowing that those are numbers that are important for you, you want to be looking for those on that summary of benefits and coverage right at the beginning of the year. You want to be doing some estimations about what it might take to get you to that deductible, and then how much further you'll have to go to get to that out-of-pocket max. You'll want to read in advance to make sure that your policy either does or does not include out-of-network healthcare spend towards your out-of-pocket max, because that may also influence how quickly you get there. And this can be something that's advantageous if you are a planner, if you have any upcoming maybe big procedures, or maybe this is the year that you're planning to get a new insulin pump or some other piece of equipment that's going to end up costing you a significant amount. You can kind of time those things on occasion to help meet that deductible, or time it so that once you've met your out-of-pocket max, that those things are being paid for at 100%. So that is an important consideration for planning the year ahead. Formularies. So the formulary is a list of drugs that is what your insurance company covers. Usually they're listed in tiers, probably heard of tier 1, tier 2, tier 3, tier 4, sometimes drugs. And they define your least costly options up to your most costly options. And something to think about when it comes to prescription items like this are that choosing generics or biosimilars in the case of insulin, and or tier 1 drugs where that's applicable, these can be a source of cost savings when it comes to drugs and other prescription items. And this is also an important time to talk about pharmacy benefit managers, which are often referred to as PBMs. These are third-party benefit administrators that are involved with things like creating and managing formularies. They often negotiate discounts and rebates with manufacturers. Unfortunately, those rebates and discounts often don't get passed on to the patient, but that's a conversation for another day. And they also do things like process and pay prescription benefit claims. So the three major PBMs that you might be dealing with are Express Scripts, which is owned by Cigna, CVS Caremark, which is part of CVS Health, and OptumRx, which is affiliated with United Health Group. So if you are covered by any of those insurance companies, you might be getting letters from those PBMs about your pharmacy items, your formularies, things changing throughout the year. So that's who those players are and where they fit in all of this. Another term that's important to be aware of as a person with diabetes is non-medical switching. So non-medical switching is defined as the changing of a patient's medication or therapy for reasons other than the patient's health and safety. So let's say the insurance company or the PBM makes a deal with a different drug manufacturer, and then they decide that they'll cover something different than what you've been taking and no longer cover the drug that you have been taking. An example of this is, let's say your formulary on your insurance plan has always listed Humalog for your insulin. And so you've always taken Humalog. And then one day you get a letter in the mail from your PBM that's associated with your insurance plan. And they say, hey, we're no longer covering the Lilly line of drugs. We're no longer covering Humalog. We are moving to Novo Nordisk, and we're going to be covering Novolog or Fiasp, which is also a Novo Nordisk drug, because of that insurance preferential pricing. Of course, that can happen vice versa. There are also other players in that game. This is just an example. It can happen with any type of drug or device. It can happen in the middle of the year. And they are supposed to give you at least 30 days warning. So definitely want to make sure that you're checking your mail. If you get those things in the mail, checking your email, staying up to date. And it's something that depending on the situation, may or may not have an impact on your care. I know Dr. On, as a provider, maybe you have, some words of wisdom of what patients can think about if they get that letter in the mail, maybe not panicking right at first, but thinking about it critically.
Yeah, I think in that example, the Humalog to Novolog switch or vice versa, or the Fiasp to Lumjev switch. So I think of it like Coke and Pepsi. I think the majority of people are going to be fine going from one to the other with a 1-to-1 dosing. So 10 units of Novolog is roughly the equivalent of 10 units of Humalog. But not every person is the same. So if you've previously had issues switching, then definitely let your doctor know to kind of fight the system and ask to stay on the original prescription. But if you've never tried the other and you're just scared to try something different, I would give it a try because unfortunately, insurance it's just easier to try it and see if it works and see how it goes. And then if it doesn't work, you can always go, that will help reinforce the doctor's argument. When they try to get that prior authorization approved, they can say, hey, we tried what you told us to try and it didn't work. So if you've never tried, I would give it a try. But if you have and you had a bad experience in the past, let your doctor know so he can fight for you, he or she can fight for you to keep you on your original medication.
Great point. And I'm wondering, just off the top of my head or off the top of your head, is there any sort of medication or situation where someone would immediately start that process of working with their doctor to advocate in the face of that insurance decision?
Like when it would not be a good 1-to-1 equivalent?
Or like maybe a patient's had an allergy to something in the past.
Correct. Yeah. So if you've had an allergy to something in the past, or they're trying to prescribe a medication for you that doesn't work because you've tried it before, or had a bad reaction to it, yes, definitely don't give it a try then because you've already tried it and learned the hard way. And that's when you'd want to include your doctor. Similarly, if it's a switch where it's not equivalent, right? So if someone wanted you to switch from one insulin pump manufacturer to another, or one continuous glucose meter sensor to another, oftentimes they are not very good 1-to-1 translations, and it would be worthwhile fighting for the product that you prefer in that situation.
Thank you, Dr. On. Appreciate that insight. So some additional things to think about when you are looking at either choosing your plan for the year ahead, or if you have the plan that's been chosen for you, you'll want to take these things into consideration. It's really important to look at the big picture as a person with type 1 diabetes and maybe additional health concerns or other things going on. You likely have a moderate to high health plan usage throughout the year. So if you can, you want to try to sketch out the planning of major purchases and procedures to help maximize your coverage throughout the year. We kind of hit on this talking about deductibles and out-of-pocket max. But if you can kind of sketch it out, you might be able to look at how you can plan for your budget throughout the year to make sure that you're doing the best you can not to be surprised by any upcoming expenses. And if you time it right, you may be able to save some money by playing by the plan rules. So you want to think, how can you save the most money and get the most quality care for the year ahead? It's also important to consider any out of the ordinary planned healthcare spend for the year ahead. So let's say maybe you or your spouse are planning on a pregnancy this year, or you have a scheduled surgical procedure. You'll want to take that into account as well. Certain plans may have better coverage for those things, or you might be able to hit a high deductible differently than you would in a normal year, and you can use that to your advantage perhaps. So you'll definitely want to think about those things. Oftentimes, unfortunately, the thing about health insurance is that we don't often know when we're going to be using it in a major way ahead of time. So that's an important consideration as well. Sometimes people have a tendency to maybe look directly at the lowest premium number on the sheet of options and call it good. But you really want to make sure that you're taking the time to consider not only monthly premiums, also the deductible, out-of-pocket max, copays for your most frequently filled prescriptions, and keeping in mind that life does happen. And if life were to happen in a way that you weren't planning for it to happen, that you would have some peace of mind in knowing that you have some good options for how you're going to handle that situation financially, and also make sure that you're really well taken care of, because your health and wellness is so important. Couple additional considerations. If you are insured by your employer, you may be able to speak with your human resources representative for policy clarification and assistance with certain coverage related issues or concerns that come up throughout the year. There are situations where, maybe there's something that is overall excluded from the plan benefits, or there's a certain struggle that's taken place in you accessing your diabetes care, your diabetes supplies, and your HR can maybe speak with someone from the insurance on your behalf. Or if it's a plan-wide issue, they might need to hear from you to know that there's an issue where people with diabetes are not maybe getting equitable care or having some issues, and they can help take that into consideration for changing the policy options for the year that comes after that. So you never know if you don't ask, and they will certainly never know if there are any issues with the plans that they're providing. They might think everyone's happy, and it turns out that you're having a really difficult time. So that feedback is super important. And then if you're self-employed and you're purchasing your own health insurance, you may be able to deduct the annual premium amount from your taxes. So that's something you'll want to consult with your tax professional about to see how that applies to you. But that's something to keep in mind if you are taking on that sizable burden of paying 100% of your premium throughout the year. I'm a big advocate. I think here at the Diabetes Center are big advocates of asking questions, get as much information as possible, do some digging. You never know what you might find out that could be helpful for maximizing your coverage. Here's a good example of that. So diabetes care equals preventative care. As people living with diabetes, or people who care about those who live with diabetes, we know that consistent and thorough diabetes care is a type of preventative care, right? We're preventing complications, hopefully, or we're working towards that. We also know there are a lot of benefits, of course, to taking care of your diabetes. And it's not always acknowledged as preventative care when health insurance is involved. Under the Affordable Care Act, preventative care is often covered at 100% or low cost amounts. So it would be really neat if your diabetes care was considered preventative. And a new development that we're seeing in some plans, not all, and I wouldn't even say majority, but some, is that there's a preventative coverage aspect to diabetes care on some plans. So on these plans, which are usually employer sponsored, tend to be a little bit more generous in nature. Insulin and certain diabetes management items may be considered preventative, so they won't apply to the deductible, which means the insurance starts paying for them on day one, which is awesome. And many times they are covered either at a reduced out-of-pocket cost or at no cost to you as the policyholder. So the only way that you're going to know about this is to ask. This is often not something that's advertised. So definitely ask questions, because you never know what you're going to find out, and it could be really helpful, save you some money, and get you the quality of care that you deserve. All right, manufacturers versus third-party durable medical equipment suppliers versus pharmacy. Oh, that's a lot, right? So when we're talking about insulin pumps, continuous glucose monitoring systems, and the associated supplies that go along with those things, you may either be asked to get them directly from the manufacturer. You may be asked to go through a third-party DME supplier. You'll probably think of some of the lists that you've been provided in the past. Call around, find one that works for you. Or you may actually be asked to go through your pharmacy for some of these items now. That's something that has shifted a little bit over the last couple of years. In fact, I believe it was this past calendar year that Dexcom shifted from being a manufacturer that ships supplies directly to patients to shifting their delivery through those third-party DME companies or pharmacy. So you may have gotten a call from a rep earlier in the year saying, hey, you're not going to be getting your supplies from us directly anymore. You know, we've sent your information to this company, or you can talk to your pharmacy about this option. And maybe you've had to shift that this year. So that's something that you're going to want to know what your coverage is like for each of those, and make sure that you're going through whichever type of option your insurance is asking you to, because that is how you're going to get the most advantageous coverage and the least amount of your out-of-pocket responsibility as a patient. It's also important to find out if your insurance company has any, as we defined here, quirks in device coverage. So some examples, and these may or may not be up-to-date examples, but they are ripped from the headlines, true story, things that have happened in the past. There was a time when Anthem Blue Cross did not cover Omnipod through pharmacy benefits. In the past, United Healthcare had an exclusivity deal with Medtronic. Certain insurance companies will cover Eversense and certain ones won't. So it's important to know if there's a specific device that you either have that you want to have continuity of care with, or that you're thinking about getting. You'll want to investigate what that looks like with your insurance plan or the plans that you're considering.
To pause right there a little bit, Samantha. So someone asked a question about this same topic, and I think you covered the issue very well. She was kind of asking, is there anything you can do to kind of get more clarity and maybe try to get some savings, or at least try to inform, like take this knowledge and make good decisions for during open enrollment. Mm-hmm. I can add a little bit of color to that. So for example, that first line about Anthem not covering Omnipod DASH through pharmacy benefit, I believe that's still true, and they're trying to change that. Omnipod is in anticipation of Omnipod 5. But it can be really confusing because as this person states, Blue Shield does not cover Dexcom through pharmacy benefit. So it's like, it's not even consistent, right? But Anthem Blue Cross will cover Dexcom through pharmacy benefit. So it's not even consistent that, you know, one insurance company will always cover pumps and sensors through pharmacy benefit, and some insurance companies won't. It will, you know, some will cover Dexcom, CGMs through pharmacy, and then pumps through DME. So it's very inconsistent. But I will say, just a practical tip, I think practically, if you're going to be on a pump and a sensor, those are probably, it's fair to say that those will probably be your biggest cost for the year. So I would almost start there and then kind of work your way backwards. Obviously, if you have other medical conditions, that could be different, but you want to start with kind of what's going to make the bulk of your purchases, your anticipated purchases for the year, and then kind of work your way back. So, you know, since Dexcoms and pumps are kind of the lifeblood for many people with type 1, if that's the case, I would really make sure you talk with your insurance company and kind of pin them down and say, hey, like, how much is this going to cost me? You can give them the product name, you can be very specific, and try to really pin them down to get a number. And I did say this in the chat to another person. When you are fielding out these questions with prospective insurance plans, please try to get as much as you can done, explained to you in writing. Because unfortunately, what I've heard a lot of patients say, and I'm not part of these phone calls, so I don't know what's said, but a lot of patients have told me that people will say things, they'll just kind of say what you want to hear, right? Because if you're just talking to some guy over the phone and there's no accountability, they can say, hey, yeah, that's covered, or hey, yeah, I've heard of that. But, you know, really try to pin people down and try to get it in writing or something, so that if they turn around, you know, 6 months later and say, oh, actually, we don't cover this, or you do have to pay more than we said, you can say, hey, like, that's not what I was told. And if you're just pointing back to a phone conversation, there's probably no real record of it. So I would really recommend getting these types of discussions in writing if possible. But yeah, I don't have a magical answer to the question, but especially when you're looking in open enrollment for pumps and sensors and your most expensive healthcare costs, really, really, really try to get a good, clear estimate of what the best cost will be, or what the real cost will be. And also, you might want to try to find an insurance company that does cover Dexcom and Omnipod, or whatever pump you use, through pharmacy benefit. And the best people to talk to there would be the reps from the company, because they know, like the Dexcom rep knows what insurances cover Dexcom through pharmacy and what cover through hardware. Similarly, a Tandem rep would know which insurances cover theirs through pharmacy and through DME. So once again, there is a lot of homework to be done, and it's super tedious. But unfortunately, as many times the case in type 1 diabetes, you kind of have to be your own advocate and really, get the answers yourself, unfortunately.
And we're going to keep hammering those points home that Dr. An just made, because they are so important. So you'll definitely be hearing more about that. And he's absolutely right. These are things that you want to take into consideration. You want to get as much information as possible. It can be hard to nail down. A practice that I've gotten into is when I do have a really important conversation with someone from the insurance, or even a device company, or a DME company, really any of these companies that are in a position to impact how I access my care, my supplies, and what that ends up meaning to my bottom line financially. I request a reference number for the conversation. So this is something that you should be able to call back and say, if you're talking to the next person and they say, well, I don't know anything about that, or I can't help you with that, or they tell you something that's opposite of what you've been told previously, that you can provide them with that reference number for the conversation, and they should be able to look that up and have a record. Also, many of these companies are now recording their calls for quality assurance. So this is a way that you can continue helping them to assure the quality of the service you're receiving. So, yeah.
And to answer the follow-up on the original question, they said, so to clarify, is it better to get CGM and pump supplies through pharmacy benefit rather than DME benefit? And unfortunately, I don't even think you can necessarily say that. I think it's more straightforward to get it through the pharmacy, straightforward in the sense that there's a little bit less paperwork, and the pathway is easier both for you as the patient and the doctor. It's easier for the doctor because we can just send a prescription to the pharmacy. It's easier for you as the patient because you can just go to the pharmacy and pick it up. However, the actual cost is going to not necessarily be cheaper one way or the other, because some insurance plans will cover DME really well. In your situation, you said they only cover 50%, but you might have an insurance plan that covers it 90%, but your pharmacy deductible is very high. So in that case, you would rather go DME because they'll cover 90% of it, versus making you pay a high deductible for your first, $5,000 in prescriptions. Samantha, would you agree with that?
I absolutely agree that it depends, just like you said. And I'm actually going to talk a little bit more about that momentarily. So hopefully that will help answer some questions, and certainly keep asking questions. If your questions and answers are leading to more questions, that's what we're here for. I also noticed someone popped in on the chat earlier and said, some insurance requires pre-authorization every 3 months for T1D pump supplies and CGM, even though type 1's not going away. How do I find that out? First of all, I would like to acknowledge how frustrating that is to have to continue getting prior authorizations and continue submitting paperwork and all sorts of things, and getting your doctor's office involved, which I'm sure Dr. An can, speak for how frustrating it is from that end as well. We know that type 1 diabetes is chronic. It's not going away anytime soon. We are cautiously optimistic for a cure, right? We'd love to see that in our lifetime, but right now we need to deal with the situation that we're in, which is that this is a continuous need, and the insurance companies don't seem to understand that sometimes. And certainly the people that we speak to may not fully understand what we're talking about. This is a pretty straightforward question. You should be able to call your member services line and say, hey, I know that I'm going to be needing these supplies. What do I need to get together in order to make sure that we have a smooth process for making this happen? If you can, highly recommend giving that call. Let's say, you don't need supplies until the middle of February. Call January 1st, January 2nd, January 3rd, whatever. Start making those phone calls to find out that process so that you can gather the documentation from your doctor's office, So you can verify who you should be ordering those supplies from. And the more time you have, the less stress it is, right? We don't want to get down to the last minute, have one sensor left, and be panicking that you're going to be going without supplies whenever possible. Of course, we can only control so much. We can't control delays on the manufacturer end. We can't control delays with faxes between the doctor's office and the insurance. But we can control calling in, finding out what they need, gathering those things in advance, supplying them so that everything is ready, so that hopefully they can just finish their end of the process there.
I'll also say that every 3 months does sound a bit more often than I've seen. So if it truly is, or I would clarify if it's truly every 3 months. I know it can feel like every 3 months, but every 3 months does sound a bit extreme. Usually it's every year. Usually your authorization will last for a year. I've heard some insurance, so Medicare, for example, Medicare used to actually be 3 months. Now there's 6 months, but Medicare was always kind of the extreme outlier. So if it's truly 3 months, that sounds very bizarre to me. So you might want to double check that it's truly 3 months. But yeah, you should be able to get that answer pretty straightforward if you ask them directly. I'm not familiar with Bright Health, but yeah. So one thing I will say, which is a good time to pitch in here, and because this is our frustrations, a funny anecdote that I did was very eye-opening for me was this is when I was at UCLA, and I was on the phone with the prior auth department for one of my patients for about 45 minutes to get something prior auth across, and very frustrating. And I was on hold and I was just angry because I had a patient waiting for me. And the doctor next to me said, the reason why it's so hard. And I was like, oh, wow. Like, really? Like, why is this so hard? And he's like, they make it hard because they want you to give up. And I thought about it and I was like, oh, it makes so much sense now. And he said, yeah, because, it's not hard to hire more people to pick up the phones and to be more helpful. But these insurance companies they don't want you to get, big picture, obviously, individually, they probably want the best for you, but big picture, they save money when people don't get their way. And so the reality is it's almost intentionally designed to be difficult, which is very frustrating for everybody involved. But sometimes in a way that almost made me feel better, because at least I was like, oh, okay, like it is just a horribly messed up system that we're having to fight with. And in a weird way, that gave me peace of mind. So, because I think sometimes we ask, oh, why isn't it easier? It should be easier. But then you realize, oh, these are companies that are not necessarily incentivized to make it easy for us. They're incentivized to save money, which is not great, but in a way, it gave me peace of mind.
And I think for people who, for everyone really with type 1 diabetes, this is so personal, right? Going without supplies, it's something that shouldn't happen, or being stressed about the idea of that taking place. So, maybe being able to focus on like the parts that you can control versus those parts that you can't. And, the flip side also of what that anecdote you just shared, Dr. On, is also like, if you can persist and give it another shot, work with your doctor to get that PA in there, whatever it takes. Oftentimes the second time it's a lot easier. It shouldn't, we could have another conversation about like whether someone should have to try twice for something like that. And that's not really what we're here to debate today. But, if you can keep with it, sometimes that persistence really pays off. So, I hate to hear when people say like, oh, I tried to get a pump because my doctor thinks that it will really help improve my diabetes care, but my insurance said no, so I can't have it. And in my mind, I'm like, okay, well, what can you try again? So, and I don't mean to simplify. I know there are a lot of like barriers to just trying again. It's not always that easy, but just wanted to kind of plant that seed of, if someone says no, maybe it's like not right now, but we should try again. So let's go ahead and move forward, because I think we're going to cover more of the things that we're talking about here, hopefully answer some more questions along the way. All right. So continuing that conversation, again, ask your insurance for their preferred in-network supplier. Verify while you're still on the phone with the insurance, finding out who that preferred in-network supplier is, and make sure that that name that they've given you, that company, is actually a diabetes DME or pharmacy supplier. I told this story in the last presentation. I'll mention it again real briefly here. One time I was doing everything right. I called, I asked for the preferred in-network suppliers that I could order my CGM and pump supplies. They gave me the name of the Hanger Clinic. I went and called the Hanger Clinic. Turns out the Hanger Clinic is for orthopedic supplies. They have nothing to do with diabetes. They don't supply anything with diabetes. And I had to start the process all over again. So, something in retrospect that I could have done is maybe I have that person hold while I do a quick search for the Hanger Clinic and see, hey, do they carry diabetes supplies? No. And then I can let that person know and kind of hold them to giving me the name of the right supplier, because they do have one. It's just that that person on the phone maybe isn't educated about diabetes. They look up DME, that's the first thing that comes up, and they call it, the end. And you're like, that's just the beginning. We're just getting started here. So something to keep in mind there. And as we were just talking about, find out if you have the option to get your items covered through that durable medical equipment coverage, which is usually a co-insurance amount, and or if you have an option for pharmacy coverage, which is usually a copay. And then you can determine which is more advantageous for you. As we discussed, there can be pros and cons. Obviously, one might cost more than another. One might be more of a set of hoops to jump through, and only you can decide what makes the most sense for you in your situation. There really isn't a helpful reason or way of thinking as to why some plans have one of those or they offer both and you can choose. I know I've had both of those scenarios where I've had the option, so I chose the one that cost me less. And then I've had times where it would have cost me a lot less if they'd let me access the opposite one, but they said, no, you have to go through this other one. So these things have to do with the cost to the insurance, the PBMs, and the deals that the insurance companies make with these different providers. So just for your own knowledge, that's kind of the why of how that occurs. And the best way to find out which of these options are available to you and at what rate is to call your member services. If you can, get the NDC numbers for the items that you are going to be getting prescriptions for in advance so that you can provide those on the call. The person that you're speaking to, if you just say like, oh, I want to know what the coverage options are for Omnipod. They might pull up, the first thing that they see is Dash, but maybe you need the old pods or vice versa. And kind of just saying like, oh no, I need this one versus that one. They might get confused. They may not understand the difference. They may give you information that's not what you're looking for. But if you Google in advance and get that NDC number, get that number from your provider, and then you specifically give that number, that's going to help cut through a lot of the back and forth. And you're going to know exactly what they're looking at because it's the item that corresponds directly with that number. And it is important to keep in mind that the person that you're speaking to from the insurance likely does not have a background in diabetes, especially not type 1 diabetes. They're not necessarily going to know the names and types and models and pieces of the systems that you're talking about. So that kind of puts the emphasis on us providing that information so that there can be no question of what we're referring to. Additionally, like Dr. On said, manufacturer representatives can be very helpful in navigating this process. They are incentivized to make sure that this purchase, this order goes through, and they really are important assets to our diabetes community. So I highly recommend that you get to know the reps for the devices and medications that you use, because they can often just help provide really helpful information or smooth a process when it gets rough. If you are ordering your supplies and medications from a pharmacy, you're going to want to find out if your insurance company has a preferred pharmacy. Your insurance may even offer you a deal on your prescription items. And by deal, I just mean, a more preferential rate if you order it through their mail order pharmacy. Some pharmacies may be more responsive or have more knowledge or be willing to coordinate through the challenges of your diabetes prescription coverage. So that can also impact maybe who you choose to work with. So a few different types of pharmacies. We've got those mail order pharmacies. These are often affiliated with those PBMs, like we were talking about, CVS Caremark, for example, et cetera. You may have some local or neighborhood pharmacies, mini pharmacy, ABC pharmacy, good neighbor pharmacies, which are everywhere. Those are, some of those options. You have your chain pharmacies. So these are the ones where pretty much no matter where you go, you're going to find one of these. CVS, Walmart, Walgreens, et cetera. And then kind of a hybrid model are these like courier service type of pharmacies where they are located locally, but then they still deliver right to your door. So an example of that is Alto Pharmacy. They deliver in Southern California, and I think they're expanding in other areas as well. So prescription items can be challenging for a variety of reasons, and a few things to keep in mind with accessing those prescription items. Your insurance company may put you through something called step therapy. So this is a type of non-medical switching, like we were talking about earlier. Sometimes it's called a step protocol, or you may hear someone call it fail first, which basically means like they want you to try something and see if it fails before they'll cover like a more expensive item in that same category. From the insurance perspective, it controls cost and risks on their part. For patients and providers, it's really frustrating. It can be potentially harmful, costly, time-consuming. And in that situation, you may need to work through the prior authorizations process. So prior authorization requires your doctor to get permission before a plan will cover, involves paperwork calls. I think Dr. Ahn was even talking a little bit about that earlier. This involves something called utilization management. From the insurance perspective, this involves safety and cost saving, but again, can be costly and time consuming for the patient and provider. If you do need to appeal or work through an appeals process to access your prescription items, first, a really easy step to skip that's actually really important and helpful is to ask why the item was rejected from coverage, because it may be that it was actually rejected based on the policy coverage, or it's often due to administrative error or confusion around billing. And if it is one of those things, it's way easier to fix. It's really fast, doesn't need to involve your doctor. It's oftentimes something you can just work out directly with the insurance or with your physician's office. And then you don't have to worry about getting all fired up and, storming the whole thing and figuring out what you're going to do next, and, having that dark storm cloud over you as you, curse the insurance coverage that you have. Hopefully it doesn't get that far. Hopefully it's just someone's small mistake that makes a big difference to you that can be fixed quickly. Additionally, it's possible that your policy covers this item under a different area. So again, like maybe your Dexcom prescription got sent to the pharmacy, but so it gets rejected, but it's covered at 100% under your durable medical coverage, but it just needs to get sent there instead. It's hard to know, so it's important to ask. And it's just important these items get sent to the right place, the prescriptions get sent to the right place, and that they're run through correctly and billed correctly. If it's not easily fixed by one of these solutions, this is where you want to enlist your pharmacy, your device reps, your physician's office in getting involved in those next steps and figuring it out from there. Dr. Ahn, is there anything you wanted to add from the provider perspective on this?
No, I think, I agree. Finding out the reason really helps. To be honest, in my office, a peek behind the curtain, a lot of times these PAs are being done by MAs who may or may not know much about diabetes and all the different things. So they might not have put in a really coherent reason, argument process or rationale, sorry, I guess I should say. So sometimes it just needs to be resubmitted with a more clear rationale. So understanding why it got rejected is a very big, very great first step.
Great, thank you. Something that I have done personally in my practice as a person with diabetes is I actually really have enjoyed getting to know the MAs in my endocrinologist's office. Like you said, Dr. Ahn, they're really an integral part of making these operations run. they really support the providers in the office, and they're doing all of these things behind the scenes. And it's important to me that I know, first of all, that the MA that's advocating on my behalf, I want them to know how much I appreciate them and the work that they do, because it can often be kind of a thankless job to be calling these insurance companies, putting through this paperwork, and be hearing patients be angry all the time about the fact that they're not accessing the things that their doctor prescribed for them. And through that process of getting to know the staff in the office, I've also been able to educate a little bit about what it's like to be a person with type 1 diabetes, educate about the difference between type 1 and type 2 when that's been helpful for them, and give them some of those helpful things that they can include on those appeal process paperwork and anything else that they're working on, that I hope has been beneficial, not just for me, but perhaps other patients in the practice. So go ahead and keep that in mind, that is something that you can do that might impact your experience and also really mean a lot to the staff in your doctor's office. Manufacturer coupons. Dr. An, you want to take this one?
Yeah, so a lot of times there are coupons that you can get at various places, and they're not the easiest. There's not just one source, easy, universal place you can look, unfortunately. Usually the doctors are pretty well informed about the manufacturer coupons we can provide. And doctors love giving out coupons because it's like we're saving people money and we don't have to, it's not like I'm paying anything or losing anything. So doctors are very happy to help their patients save money. If most manufacturers do have coupons, insulin coupons aren't particularly great, especially for the fast acting insulins, but for the long acting insulins, sometimes there are good deals. And for the Libre, for example, there is a pretty decent coupon, not for the Dexcom though. You might want to ask your doctor, you might want to search online. Websites like GoodRx are a pretty good resource to search through coupons, but it's not comprehensive. Just because the coupon's not listed on GoodRx does not mean that it's not available. The best place to look for manufacturer coupons, I would say, is a combination of GoodRx and going to the website themselves. So for Humalog, for example, going to humalog.com, and pretty much every drug medication website will have a link somewhere at the top that says patient savings or savings and support or something like that. And so that might be a good place to start.
Awesome. Thank you, Dr. An. That's really helpful. Look, the worst thing that happens is you search for it, you don't find one, but you'll never know if you don't look. You'll never know if you don't ask your doctor. Ask the MA in your doctor's office. They, get the stuff from the reps. They know what's going on as well. It's important to ask around, and let's go ahead and keep talking about ways to access diabetes medication. Insulin access. I think this is something I would love to hear Dr. An's perspective as the prescribing provider here. We have some different options of things that you can look at, but Dr. An, what do you have to say about that?
Yeah, so I think samples are a really good option. Kind of like coupons, it's at zero cost virtually for from your doctor, maybe just the electricity fee for the refrigerator in his back office. And the more samples they give, the reps are happy, because that means that they're probably the doctors are probably recommending their product. So pretty much everybody is happy when samples are flowing. And patients obviously like it because they're getting free products. So I think as long as you're being respectful of other patients and their panel, right? So you don't want to, you're not trying to be fully supplied from samples, but I don't think it hurts to ask for a sample when you're seeing your doctor and say, hey, do you have any samples that you could provide? Or I'm in a pinch. Obviously, if you are financially well off, then you might be more considerate and not take advantage of samples from your doctor. But in general, there's really no reason, if I have supply in my back fridge, like why I wouldn't give a couple pens to a patient. And a lot of times we do have different providers have different things, but sometimes I'll have samples of pen needles. Sometimes I'll have samples of Dexcoms or Libres. Sometimes I'll have samples of syringes, pills. So it doesn't hurt to ask. Patient assistance programs are also a really good option if your means are not very good, or if you lost your job, or if you're in a hard financial situation. Pretty much every medication company and device company has patient assistance programs. And basically, if you fall below a certain income level, you can be eligible for either free product or discounted product. And so you can pretty much Google any manufacturer and type in patient assistance, and you should be able to come to an application where you just have to provide documentation of your financial hardship, and they will send you either a really, really discounted price or free product. There's also FQHCs, which are federally qualified health centers. So these are things like SOS clinics. So they're kind of like charitable clinics, or for people that are underserved or underinsured. And these pharmacies actually get medications for pennies on the dollar. So they often will sell medications at a very low cost. So once again, if you're in a hard situation, you might want to connect with one of these FQHC clinics because they have medications available at very, very low cost. But once again, you do have to be underinsured. But an example in Orange County would be the SOS clinic. In other charitable programs, we do have an insulin relief fund at Hoag Hospital, where philanthropy has donated money to help us purchase Lantus and Humalog pens. So if you are in a situation where you can't afford insulin, please reach out to us at the Diabetes Center, and we can arrange for you to pick up some insulin free. Once again, you do have to kind of be in some sort of hardship, and if you can afford your insulin, please help save it for people that can't afford it. But if you are in need, don't be prideful, and please reach out, and we're happy to help.
Absolutely. Obviously, it goes without saying, if you have type 1 diabetes, don't go without your insulin. You can't go without it. So if you're facing challenges from your insurance company, your pharmacy, don't give up, keep looking, call your doctor, look through these patient assistance programs. Look at these charitable clinics, and certainly if you're in our local area and you're in a hardship situation, please do utilize like the insulin relief fund and other local programs, because that's what they're there for. Let's talk about some insider tips. Something that I don't think is actually on here, but I know I've seen a little conversation going back and forth about different DME providers and pharmacy providers that are in network with various insurance companies. Best way, again, to find out what that in-network provider is for you is to call your insurance. Certainly do verify with that pharmacy or that DME provider that contract is still active. Obviously, there can be occasions where your insurance may still list someone that they're not contracted with any further. You want to make sure everyone's on the same page. Sometimes there are challenges that people have with different companies, and their reviews can maybe be discouraging. I would just say try to keep an open mind. I know that I have been pleasantly surprised by companies I had been told like were difficult to work with, and then had more challenges with companies that I had been told were great to work with. I think it really just is one of those things that you have to figure out how it's going to work just by doing it. And you stay consistent, you stay persistent, you get all the paperwork, and just continue advocating for yourself through that process. And if you have an issue with one DME provider and you really want to switch, your insurance should be able to offer you some alternative options. It shouldn't just be one typically. So something to keep in mind. Let's run through these. These are some kind of fun as far as insurance is concerned. I guess maybe it's not fun to most people. Take advantage of insurance wellness benefits if that's available to you. Maybe your employer has an incentive program where if you participate, you get a form filled out at your doctor's office or whatever, that you get some sort of incentive, either in your premium reflected in a discount. Maybe they give you some extra money to an FSA or HSA account to help incentivize your use of that program. Or sometimes it's cool swag. Like I have seen people get gift cards for all kinds of things. So you never know, and you don't know if you don't ask. So find out. Life is busy. Diabetes has a lot of things that it requires of you. And then you also have to be a full-time human being with other things that you'd probably rather be doing. So with that in mind, utilize reminders and auto refill programs for items that you need monthly or on a regular basis of some sort. Write down dates. Don't try to remember it in your head because you will forget. That's just the way things go. So do as much as you can to try to support yourself through that process. Work with your doctor to ensure that your prescription is written to accommodate for things that you might not expect. Maybe you're going to be going on a long trip and you won't be home to get your regular prescription refill. Maybe you'll need it written a different way for that reason, or making sure that you have enough in case you need to evacuate your house in the case of a natural disaster. Those are different things you can talk to your doctor about, right, Dr. Ron?
Yeah, for sure. So most doctors are going to be able to write for a little bit higher of a dose because, if you're sick, you're going to need more insulin. I call this the zombie apocalypse stash that many of my patients with type 1 like to build up. And so I do try to prescribe a little bit more to allow them to build up that zombie apocalypse stash. And yeah, so for life's unanticipated issues, I think that's well put.
Awesome. Yeah, there you go. And another kind of related thing, you'll want to try to fill your prescriptions on a regular basis so that you always have those supplies. You never want to run out to zero before you get a refill if that's something that you can't avoid. And certainly that's a situation where, maybe if you're not filling your prescriptions on a regular basis because of a financial hardship, fill in with those community programs and make sure that you're not going without. Stay in touch with those drug and device reps. Like we talked about earlier, they are really helpful at navigating that approval process. They can help you in a pinch a lot of the times. These people really care about our community oftentimes. So make sure you connect with them. Do your best to plan ahead. We keep saying that, but it's worth hammering home. Factor in those upfront costs of meeting your deductible and see how you can work towards meeting your out-of-pocket max and really maximize that time of year. Stay organized, and when you can, plan ahead, since sending faxes back and forth, working with your doctor's office, insurance companies, these different things, these hoops that we have to jump through sometimes, they can take longer than expected. Certainly when those things come up, they're our number one priority as a patient, but there can be competing priorities for the other players in that game. So the more lead time you give yourself to process through that, the better. And be honest with your doctor about your affordability concerns. A lot of times they're not aware of how much you have to pay for your medications. It's something that you can be honest about. It's a safe space to talk about these things, and your provider can help determine which of the therapies really are a fit for you so you can meet your diabetes goals and stay within your budget. Dr. On, do you have anything to add on that one?
Yeah, no, I think you put it well. I think we really don't have a lot of visibility into how much people pay for medication because sometimes our system will give us a hint, but it might be wrong. So we really have no idea what patients will be paying. We try our best based on what we've heard from our patients, but that's why hearing your stories helps us so much. Because if one patient tells me, of a story, then I can, tell other patients in that similar situation with that same insurance or something like that. So we really have very little insight into how much you're paying for things. So yeah, don't hesitate to let us know. Even for, we're in Newport Beach and, I always joke around, like even for these really wealthy people in Newport Beach, sometimes, paying $500 a month for a medication is just kind of it just doesn't make sense. And so there are a lot of times there are cheaper alternatives. So it might not even be something where you can't afford it. It might just be like, you're looking for a cheaper option. So, don't feel bad talking to your doctor about how much you're actually paying because sometimes they have no idea.
Absolutely. So many things to consider with that. And certainly if you are maybe not meeting your diabetes goals because of affordability issues with accessing medications and care, please be upfront with your care team about that. They want to help you, and they certainly don't want to see you struggle with your health because of something financial. So we have resources. Let's put them to good use. And finally, but certainly not least important, stay connected with the patient community. The type 1 diabetes patient community is very in tune with what's new and also what's flying under the radar, about making the most of your supplies, about accessing supplies, about just all aspects of living with diabetes, really. The Diabetes Center here at Hoag Hospital has support groups to help connect people. But if you don't live nearby, you can still participate because right now we're virtual. But also if you prefer to connect from a distance overall, you can check out online communities, Facebook, Instagram, forum boards. There's definitely ways to make some diabuddies that don't live near you, or maybe that do, and learn more about how other people with diabetes are managing aspects of their care, overall life with diabetes, and certainly navigating their insurance coverage. We talked about some of these resources before. We'll just run through them again. If you live locally, we do have that insulin relief fund for people who are experiencing financial hardship and need access to their insulin, type 1 diabetes. You can look at GoodRx and other discount programs for cash pay. Sometimes you might find things that can be helpful also if you have insurance. Just need to look at the fine print and see if it applies to your situation. If you're looking for health insurance coverage for now or for the coming year, Covered California and Medi-Cal are two potential options for accessing coverage depending on your situation. You can apply for both of them from the same application on the coveredca.com website, so check that out. And JDRF, which is a type 1 diabetes advocacy organization, and the American Diabetes Association, those are two resources. They have a lot of literature online about navigating insurance and other type 1 diabetes related issues. So definitely check those out. And you can also contact your local chapters if you have specific questions. So definitely utilize those connections in the community. I can't emphasize this enough, and I think Dr. Ahn has said this a few times also throughout this presentation. Be your own advocate. You are truly your own best resource in getting what you need as a person living with diabetes. Nobody knows what you need to take care of yourself better than you do. These people at the insurance company, they're doing their job. It's not personal, but they don't know your life. They don't know what it's like to live with type 1 diabetes. They don't know how urgent some of these things are. So if you need to, communicate that to them. Let them know why it is that you're calling and why this is so important, and keep pushing up the ladder until you find someone who can help you get what you need. And being your own advocate sometimes also means asking for help and not doing this alone. So maybe that's enrolling your physician's office, one of these nonprofit advocacy groups who can provide some support. Maybe it's a nonprofit that helps provide charitable assistance with medical care. Maybe it's just having a pal that you can call and say, man, I had the roughest phone call 3 hours with my insurance today, and maybe they can offer some advice. Maybe it's a social worker who can connect you to resources. Maybe it's a mental health provider that can help you manage, the difficulties of living with type 1 diabetes and having to jump through these hoops. So be your own advocate, and know that sometimes being your own advocate means asking for help, and that is good and it's okay. So we'd love to invite you to join us for some of our upcoming programs with the Mary and Dick Allen Diabetes Center. We offer the Herbert Family for Young Adults with Type 1 Diabetes First Fridays program. So this is for ages 18 to 35, young adults with Type 1 diabetes. Our next meeting of that group will be online Friday, October 1st. So that's this coming Friday at 5:30 p.m. We also have a Type 1 diabetes virtual support group, all ages 18 plus. Our next meeting is actually tomorrow, September 30th at 6 p.m. And then our next meeting after that will be Thursday, October 14th at 6 o'clock p.m. We also have a diabetes and pregnancy virtual support group. So if you are living with type 1 diabetes and you are entering the process of considering building a family, or you are pregnant with type 1 diabetes and you want to come talk about diabetes and pregnancy, join us Wednesday, October 13th at 11 a.m. If you have questions about any of these programs or anything from this presentation, you'd like to come see Dr. On or any of our educators, dietitians at the center, you have a question for me, you can reach us at 949-764-8065, or you can also send us an email at diabetescare@hoag.org. And now we will answer any questions that are still hanging out there. I know Dr. On's done a great job of peppering them through and trying to answer as many as we could throughout, but this is the time. If you have any questions, we'd love to answer them.
There was a question, how do we join the group tomorrow night?
That is an excellent question. I believe that the registration may have closed. Go ahead and send us an email at diabetescare@hoag.org, and we will get in touch with you prior to the evening tomorrow. So look out for communication maybe in the mid-morning to afternoon. We'd love to have you.
Cool, I think that's it that I see. And I know we went super long, so thankful for all of you that stuck around till the end. And thank you for the team back there that's helping us do all this. I think that would be it, right, Samantha? Anything else? Do you want to close this off?
Well, like Dr. On said, thank you so much for joining us. This is such an important topic, and due to the ever-changing nature of insurance policy in this country, insurance plans shifting from year to year, it's really important that we keep discussing it and that people ask their questions and we bounce ideas off of each other. So if you think of anything later, you can always reach out to us, and we wish you a very happy, healthy, and successful open enrollment season.
Thanks.
Take care.